Awesome. Hi, everyone. I'm sure there'll be a few more people that kind of pop in as well, but thanks for joining us today for our Lunch and Learn series. This one is going to be on eRefferal. So I hope you enjoy the content today. And as always, with any of our Lunch and Learns, the recording is going to be made available afterwards on our website. So we'll post that. So for today's agenda, so we're doing a welcome. We're going to go over quickly what is an OHT. Hopefully, it's not new information for people on the call, but for those that might be a little bit unfamiliar with the concept of an OHT, we'll go over that. We're going to do some introductions with the East Region deployment team, and then we'll be doing an overview of eRefferal, and we'll be talking both about Ocean and as well CareDove. So there'll be a demo for the Ocean aspect on how to send an eReferral, and then we'll open it up for questions that people might have around potential support they might need for their office, or questions about just how to get support in general. So we look forward to going through all this content with you guys. So just to start off with what is an OHT? So we have this quote here. So at maturity, OHTs will be clinically and fiscally responsible for providing a continuum of care for a defined population. And that was in the path forward back in 2022. And our vision as the KLHOHT for locally connected care is that we enable it by improving the transitions in care, the ability to provide care in the right place, the right time, by the right provider, enhancing the ability for providers and patients to access their health information through shared or single records, integrating and standardizing pathways and models where appropriate, understanding and responding to local complexities and needs through an equity-oriented population health lens, and as well providing 24/7 navigational supports to increase access and awareness to supports and services available in the community, which we'll talk about today, actually. Our plan for the OHT, and we've kind of formed a lot of different working groups and committees throughout the OHT to address the following areas. Firstly, advancing integrated care through the creation of integrated clinical pathways, things like COPD, CHF, palliative care, etc. Advancing digital health maturity and the ability to share information across multiple settings, as well as so increasing primary care engagement activities and increasing engagement with equity deserving populations. So with that, to the topic at hand today, eRefferal. So I'm happy to introduce the eRefferal deployment team in East Region that will be the primary folks helping the supports and deployment of eRefferal within the KLHOHT. There's two people on the deployment team to support. We have one on the call with us today who's going to be going through some of the content. So we have Jap Juddy, who's the eRefferal change management specialist through the Scarborough Health Network. And then as well, Ryland wishes he could be here today, but he's in Cuba. But Ryland Steele, eRefferal consultant with Ontario Health East. So with that, I'm going to pass it off to Jap.
Yeah, thanks for that, Raymond. So, hi, everybody. As Raymond just mentioned, my name's Jap. I help support eRefferal in the Central East region. So, if you want to get set up as a receiver, if you want to learn how to send eRefferals, I'm your one-stop shop for eRefferals. I wear two hats. One is as part of Ontario Health East, and the other part is as the local delivery group. You guys may have heard that Ontario Health is expanding the way that they deploy digital health services, and the local delivery group is going to be a part of that. So I'm also part of the local delivery group that is housed out of Scarborough Health Network. So Raymond, do you mind going to the next slide? So yeah, here to talk about e-referral. I just want to know it's a pretty small group, so if you guys have an immediate question, please raise your hand, put something in the chat. I know we have somebody monitoring the chat, or just feel free to unmute yourself and ask a question. There is going to be time for questions at the end of the presentation, so you can hold on to it at the end, or you can just say it right away. So I'm gonna hope that most of you guys are familiar with some aspects of eRefferal, but really it's a platform which you can use to electronically send and receive eRefferals. the main reason why we hear about Ocean eReferral compared to other eReferral systems is because it integrates with a lot of the most common EMRs, like PS Suite, I think is of interest to this group here, but also Accuro, Oscar, and other HASs such as Epic, Meditech, and Cerner out in the community. Go to the next slide. So the biggest question I usually get about eReferral before anybody, is interested in asking about, how it works is it free? So I want to confirm that, there was a eReferral funding pause last year while they were going through an RFP process that is now concluded. So eReferral funding is available for anybody in Ontario, and the funding would cover eReferral setup and EMR integration. It covers any, sort of training, so resourcing like myself or Ryland who will come and train your clinic virtually, and ongoing support. So if you get any, new staff down the line, you can reach back out to us, ask for help configuring their account or giving them some extra guides or developing new workflows. So everything related to eReferral is fully funded and fully covered for senders and receivers. Next slide, please, Raymond. Thanks. So one big thing I want to talk about, I know there's a lot of buzz about standardized referral forms. I think this is usually a little bit bigger of a deal to receivers rather than senders. Previously, when you were sending a referral form to someone, they would design their own customized e-referral form. Ontario Health has decided to standardize referral forms. There's a library of standardized referral forms that's linked over there. It contains referral forms like medical imaging, nephrology, dermatology, and a whole suite of other specialties. And now, whenever you refer to somebody, that's a net new receiver that they're getting signed up within the past 7 or 8 months or so, they're going to have to use this standardized referral forms. As a family practice, I think this will help you guys because it's going to just make it easier for you to refer. That any dermatologist you're referring to anywhere across the province is going to have a similar form, and it's going to help you guys, you know, fill those out a little bit quicker and make things a little bit simpler for you guys. But any questions about standardized referral forms, please feel free to ask. Next slide, please. Thanks. So here are some of the biggest benefits for sending providers. So first off, fax is a pretty outdated medium. We know that, fax machines go down, you send off a fax, it goes into void. There's things like shotgun referrals with e-referral. All of that is gone. It's guaranteed transmission. You know who has the referral, and you get referral updates based on its status as the receiver actions on that referral. So it's a lot better of a technology. There's a map-based directory, so no longer do you have to Google, oh, who's available in my area. The wait times are going to be there. You can even search by proximity to your patient's home. As I mentioned before, the status notifications is usually really helpful. Integration speeds up the way that you can refer. It's going to grab data from your EMR if you're using one of the integrated ones and put them in a referral, saving you time when you want to refer. And this is the last point on here is really big for admins. I find a lot of family physicians admins tell me that the Ocean messaging feature is really great. So if you ever want to update a referral, you could just, add an X-ray attachment if you sent the referral on the 12th, and then, your X-ray came out on the 14th. So you can add that after the fact, or you can ask questions or respond to questions from the receiver. This really cuts down on phone calls between clinics. We know it's impossible to get folks on the phone now these days. So I do highly encourage anybody using Ocean to try out the messaging. We're getting a lot of positive responses based on that. There's a lot more benefits as well, but we don't want to just put too much information on a slide. You'll see it when I demo it in a few minutes. So I just wanted to provide a high level overview of what implementation would look like. So usually there's an introductory meeting. I'll meet with a family physician, their office, their MOA, a admin, whoever's, the most likely candidate to send referrals. And I'll just, provide a similar sort of demonstration like I'm doing today. At the same time, at the end of that session, we usually request that they're going to sign the ORF, so the onboarding request form. It's just a form that is going to help execute agreements from the Ontario Health side. So the funding's available as long as you're able to go through the legal agreements. If you're a practicing family doctor in Ontario, you're going to have no issues going through that. After that, the deployment team, which is myself, will help create your Ocean site. If you're a receiver, this is where we would create your form. We would also integrate your EMR. It depends on what EMR you're using, how long it takes. For TELUS, I find that, if you're pretty good with your EMR, you can get it integrated in as little as 5 to 10 minutes. Some of the receiver integrations that are a little bit more complex, like Acuro, can take somewhere around half an hour to 45 minutes. After that, for the first four steps, we may actually do it all at once if it's possible. If you're a telesender, we could do it all at once just to save you guys some time. Usually, we would have one follow-up session, and that would be training and go live, where I would meet with your staff. We would discuss workflows, help set all the accounts up, and then run you through setting a referral and leave you with some guides. And of course, that wouldn't be the last time that we touch base with yourself or your clinics. We are always available to reach out to for ongoing support. If there's any sort of new features, we send out emails based on what we think may help your clinic. We do refresher training, and if you're a receiver, sometimes you would want to switch your form. We would help with things like that as well. So really, we cover everything from A to Z. So anything related to e-referral, you'll have a singular point of contact, usually myself or Ryland or someone else on my team, and we'll help you through all these steps if there's any issues.
So, yeah, and I'll just mention as well, a lot of our clinics may have already gone through the process of doing some of the EMR integration. So you don't have to redo that process for anyone that's curious. We might have to double check to see if you signed the new e-referral agreements that are between yourself and Ontario Health. But a lot of folks might be in that training go live section where maybe they sort of started to use it but um, haven't received a full training, so aren't aware of all of the cool tips and tricks that you can do. So I think that's still where it'd be beneficial for Jap or Ryland to still provide some additional training, so they're available for that. But I think now I think we'll get into the demo.
Yeah, thanks for that, Raymond. And I know we do have a cohort here, so if anybody's already using eReferral, I'd love if you put it in the chat and let me know that if you're using eReferral or even better, what EMR you're using. I'm going to be doing a pretty generic demo right now, but I can always tailor it if I find out, you're using eReferral and who you're looking to refer to. Just confirming that you can see my screen and it shows TELUS, Raymond.
Yep.
Okay, let me just move this out of the way. Okay, so I'm just going to be portraying as, a regular family doc. My clinic uses TELUS, and I want to send a referral because my patient, they hit their head, and I was like, okay, you know what? They need a CT. So what I first do is I select my patient in TELUS. I'm from Toronto. I'm a big Drake fan, so today we're going to be referring patient Aubrey Graham. And before we send this referral off or we go into the Ocean Health Map, we have the opportunity to add any attachments. What I'm going to do is I'm going to green bar any attachment that I want to tell us. So I'm simply going to click on this box over here. You're going to see that it turns green. This is now going to attach alongside the referral that I sent. I just chose a previous console note. This is a demo. You guys would obviously choose something a little bit more relevant to the referrals that you're sending. So now that I've green barred any attachments and I've selected the correct patient, what I'm going to do is I'm going to click refer in this toolbar. And it's just going to ask that I'm selecting the correct site. That may not happen to you guys because I'm part of many sites. And over here, it's just going to ask me to name the attachment. I'm going to skip naming it for now. So what comes up, I'm going to just drag it over. I have two monitors, so this came on another screen. This launches the Ocean Health Map. The Ocean Health Map is a directory used to find clinics and clinicians that are receiving referrals. This is where I usually get a few complaints from, family doctors that the Ocean Health Map doesn't work as well as they want. So I'll be providing some like common tips and tricks that I would recommend. So first off is in the top left corner, you can find any health service. So you could search for a clinic name, you could search for a doctor name, or you could even search for a health service. So for example, if I type in SHN, which is my home hospital, you can see all these blue stars start to litter the map. They correspond with ocean listings over here on the left-hand side. If it has a green arrow, it means that it's live and it's accepting e-referrals. Let's say you don't know which particular clinic you want to refer to. You just know you want to refer to a gastroenterology clinic. You can search by gastroenterology as well. And you can see that all the clinics that have that listed as a service are over here on the left-hand side. You even have the option to filter for the distance from your patient's home if you put in the patient's address, or you can even filter by wait time. And this is something that I know family docs love is they'll filter by wait time. So, some of these clinics, they'll see your patient in 30 days, some of them 3 days, or so on and so forth. So I'd recommend that if you're filtering by service, you do take a look at the wait times associated with each clinic. What I found is that clinicians usually refer to the same clinic over and over. So I always recommend that family physicians take use of the favorites tab, which is found over here in the top left where the star icon is. You can see I have a library of favorites that I've selected, and these are clinics that I refer to over and over. So, for example, here's SHNDI. Um, as soon as I click on favorite, I go right to that listing where I can click send e-referral. But I want to take a look at a listing first. So a listing always has the title, the address, the phone number, and languages that they speak. Other common things that would be here is fax number or a website, if that clinic has decided to add that. I would recommend that the first time you refer to any clinic, that you read the listing description. Sometimes it contains key information about what this clinic does and what they're looking to receive in terms of attachments while you're referring to that clinic. Um, One other common complaint I get is that, I've searched for something on the Ocean Health map, but it's not coming up. So I'm going to give you an example. So I'm trying to refer to Ontario Shores Center for Medical. So there's probably some spelling mistakes here, but that's part of the education over here. So I'm going to search for Ontario Shores, and you can see that I can't find Ontario Shores after I click this magnifying glass. What I would recommend is if you're having trouble um, finding any clinic, I would shorten your search term. So just search for Ontario Shores rather than trying to type out the entire listing name. And you can see now that I typed out Ontario Shores, I find the outpatient service, and I can refer to them now if I want. Um, the last maybe tip I'll give is the more you zoom in on the health map. So if I search for Ontario Shores over here, well, Ontario Shores is a bad example. Let's search for SHN over here. You can see that whole sort of cohort of SHN clinics that was accepting referrals doesn't show. If I zoom out a little bit more and I search again, now the full list will come. I think Kawartha Lakes generally refers to pure HC, and there are many pure HC clinics live on Ocean eReferral, and we're looking to get more pure HC clinics as well, but you guys can correct me and let me know who you guys commonly refer to. Okay, those are the regular tips and tricks for sending a referral. What I'm going to do now is I'm actually just going to send a referral. So I'm going to quickly go to my favorites tab. I'm going to go to the diagnostic imaging demo site. I'm going to quickly toggle on a test mode because this is a test clinic. And what I'm going to do is, I've reviewed this listing. This is where I want to refer my patient to. I'm going to go ahead and send an e-referral. So the first thing that you're going to note is that the patient information is already filled out. So this pulls from TELUS or from my integrated EMR into Ocean. Other examples of things that pull is CPP, so things like allergies, medications, previous family history. If that's filled out in your EMR, it will come into Ocean, saving you time for having to fill it out. So the other thing that automatically fills out is after the first time you refer, your referrer's information will fill out. So I'm referring as Dr. Jap Judy today. You might be, referring as Megan Wynn or Tiffany or Deanne, and your information would fill out. You can also refer on behalf of somebody else at your clinic. So if anybody in here is an admin for a doctor, or you work on behalf of multiple doctors, you can refer on behalf of someone else. So in this case, I can also refer on behalf of Dr. Ryland Steele if I'm set up as a delegate. I know a lot of group practices find this very useful. And the other thing that pulled in from the EMR is this attachment. You can see that file over here. If I click on this eyeball icon, you can see that it's that previous referral that I attached. Normally, the way that you would fill out a referral is you would just answer all the pertinent questions on the referral form. So, this patient speaks English. Yes, they can provide consent, bill to OHIP. What we said is, this patient is for CT head. Let's just go to MRI just so I can demonstrate the form. So this patient we're sending for an MRI. It's a patient fell and hit head, and we're going to select, head and neck, and we're going to, answer all the pertinent questions. You can see that the height and weight came in from the EMR, and you would answer any question that has a star next to it because it's a mandatory question and you're required to answer all of those. So the idea is, I think you see it, that these are examples of smart forms. As you click on one part of the form, other parts expand. And so you don't have to, go through 4 or 5 pages trying to figure out what do I have to fill out, what's necessary. Ocean will guide you by your actions into what you should or should not fill out. But I want to show one really cool feature. I'm not sure if anybody in the Kawartha Lakes region is using this new feature yet, but Ocean recently came out with autofill templates. So if you find yourself referring to one clinic for the same sort of indications over and over, I would recommend you create an autofill template. So I'll just show you an example of what that is. So I have a CT head autofill template. So I just click on this, and you can see that this referral form is already filled out with answers that I've selected. So I created a template that every time that I come to this form, if I select my template, it's going to fill out the pre-selected answers that I've decided. So if you find yourself referring for, patients who fall and hit their head for CTs a lot, it's very simple to refer. You can just launch Ocean from TELUS, go to your favorites, click send a referral, autofill your template, and you can send the referral off that quickly. It would only take, once you get a little bit used to the system, you could send off a referral with an autoplay template in under a minute. And even if you have to fill out the referral form, we find that it's quite quick, and most physicians can send out simple referral forms in a few minutes. So as I click on send test referral, this is a key part of using Ocean eRefferal as a sender is giving consent to use your patient's email. Um, if your patient's email is included with the referral, so if I gave this consent, they're going to get status updates based on the referral. So as soon as you send this referral, it'll be okay. Shauna has, sent the referral, um, and if which provides a lot of peace of mind for your patients. A lot of times they're going to be calling your office. Did you send the referral? Did they get the referral? They'll get those level of status updates if you include their email in the referral. Since it's my personal one, I'm just not going to give it, but I would highly, highly recommend that you guys do. And it's just going to ask to confirm that, it's correct patient, correct source, and correct referral. We're going to say yes. And there we go. We have sent our first referral. One of the most common questions I get is, Jap, does this go back to my EMR? I don't want to go into Ocean to always track my referrals for TELUS. Yes, it does. Let's go back into TELUS and let's see what happens. We're going to just reload this patient. And you can see, sorry, there's a couple of pop-ups that I'm just going to close, that over here on February 11th, which is today's date, I sent a referral for CT head and neck to the diagnostic imaging demo site. As that receiver actions on the referral in Ocean, so as they accept it and they schedule it, you'll get updates in your EMR. You can even play around with TELUS settings so that perhaps your admin gets these updates rather than yourself, or nobody gets those updates at all. But that is the general Ocean workflow. You come into TELUS, you select your patient, you green bar your attachments, you go into Ocean, you either select from your favorites or you search for who you would like to refer to. You can filter by wait time, filter by distance. When you get to the referral form, you can either fill it out manually or you can even create autofill templates if you think that's a clinic that you're going to refer to over and over. You would fill out the form, hopefully include your patient's email, and then send off that referral. There are a few additional options you can use in terms of referral tracking. So I'll go over these really quickly. I don't want to go into every minor detail because this may not be applicable to all of your clinical workflows, but if you click on the portal icon, sorry, I didn't see what I clicked on. If I click on the portal, I get launched to the Ocean portal, which is used to manage your sent and your received referrals. Over here, I can see all of the sent referrals that I have. Um, and I could check on their status. I'll know if they're in pending booking, that the clinic has accepted this referral. I'll see if it's in book confirmed. I'll know my patient has a confirmed appointment. So this is really good for your staff to come in and see, okay, patient Jenna Bowmanville has an appointment February 5th, 2026. You have the option to add additional attachments. So I'm just going to clear my folder. So let's say patient Aubrey Graham, I forgot some sort of information. I find this patient in Ocean. What I can do is I can edit some of the answers I've already gave. So, I said, okay, no, this patient actually has a different preferred language and it's, Hindi. And I can update that and it will send a notification to the receiving clinic. Hey, Dr. Judy has sent this update. Um, I just did a language change. You guys would probably do something a little bit more pertinent to that referral. You can even add attachments after the fact. You can do this from TELUS, but I'll just show you a manual workflow that you can add attachments. You can go to your local drive and just add any sort of PDF, X-ray, whatever it is, and you can add that after the fact as well. So this is a living document. It's not like fax where you send it off, it just goes into the void. If you have any sort of updates onto your referral that you believe, will help this referral go through its triage or is important for the receiving clinic to know, you can always add that after the fact rather than just starting over and re-referring. Um, there's a lot of bi-directional communication that can happen in Ocean. They can send you messages on referral. You can send them messages, and we have a handy folder called Needs Review. I would highly recommend if you're already using Ocean e-referral. I have noticed that some family doctors do sometimes neglect this folder, but this folder would give you any important status updates on a referral because you can see I have 109 referrals here, but these three referrals have a message associated with them. A message could be that the receiver has declined your referral, they've responded to your message, or they have sent you an initial message. So this just helps you sort of figure out what do I actually have to do in Ocean rather than clicking through each referral and seeing if there's an update on it. So, for example, for patient Tom Test, I could see, you know, this referral was declined. They gave like a demo reason. Um, I could just click reviewed and close. So I know that um, that it's removed from my needs review box. That patient is no longer here. Sometimes if it's a declined referral, you can respond. They said, okay, patient's phone number wasn't working. You can respond with the correct phone number and resubmit that referral. So you don't have to send a brand new referral for the same patient. Um, I am going through a lot of stuff here, so I hope this is coming through, but there's a lot of even more snazzy features with Ocean. I don't want to go through them all because clinics kind of pick and choose what's best for them. But these were some useful features that I find that most clinicians use. I'm not sure if there was any questions in the chat. I don't see any, but please, if you saw something here that you're not using with Ocean, or if you're not using Ocean at all, this was all brand new, please do let me know via the chat. We are going to have a question and answer period at the end, but happy to take any questions.
Awesome. Thanks, Shep. And also, I think for folks, I think this is really where it'd be beneficial for either Jap or Island to help out with your office because everybody does things their own way that they're comfortable with doing. So some offices, even for the notifications, as an example, might be the process where you have an admin that reviews all the messages or triages messages before it goes to the physician or nurse practitioner. And in those cases, it could be the admin who maybe manages that needs review inbox. Or there's some offices where the clinician would like to be the one to review those things. So I think that's really where it's helpful for us to have Jap and Ryland come into the office or virtually rather to support the office and getting you guys set up how you would like to be set up and what makes most sense for you so that it's seamless for you. Awesome. I want to talk a little bit about as well cared of and the kind of the navigational platform aspect that we also have available. That's also integrated with Ocean as well. But I wanted to highlight that we also have for a lot of our community support services a navigation platform on the website to help find services, and we do also have a phone number as well that people can call. Really with the goal of improving access and awareness to community supports and services available. Um, really beneficial, especially the website version on the KLHOHT website, really beneficial for patients wanting to self-refer. And I'll talk a little bit about later on providers referring to some of these listings through through Ocean as well. Um, but really, we have a big listing. Or there's lots of listings available through the CareDev network as well. So there's 65 organizations listed, so over 320 services individually listed as well, and a bunch of different receiving organizations able to accept e-referrals through Ocean. And a lot of organizations able to, of course, accept phone call or email referrals. So a lot of these resources are available through the KLHOHT website. This is kind of just a highlight as to what those sort of look like. So again, a similar kind of map-based directory. So this can be helpful for, again, patients wanting to self-refer themselves to services. And along with the listings has the intake referral forms, similar to Ocean. But I think where there's lots of benefit is through that Ocean CareDev integration, the bidirectional integration. So if you're a primary care provider wanting to use Ocean or not wanting to use different methods to refer patients, a big benefit is that we do have a lot of those listings that are on our website also available through Ocean. So the same way that Jap was showing before, how you can search for different listings available on Ocean. A lot of the CareDev listings will be available on there. And sometimes you might not even know that they actually are a CareDev listing. It's fairly seamless in that aspect. Um, but you still have the same abilities and features that you do have with a regular Ocean referral, where you can add attachments as an example, and also pre-populate the referral forms with any EMR data as well. So as long as it's some information's filled in on the EMR and like the cumulative patient profile, that'll also pull forward into the CareDev referral. We're always looking to get feedback on what services should be made available through this integration, or just be made available um, on CareDev or Ocean in general from the community support service lens. So definitely would appreciate if anybody wants to just type into chat as well some of those key services that they would like to see available or made through Ocean and CareDev. Specifically, I think community support service ones. The eRefferal deployment team, so Jap and Ryland are going to be working hard to get a lot of receiver destinations on board for things like community specialists, and like any of the diagnostic imaging, et cetera, those kinds of things. But where the OHT we can help out as well as with some of the community support services through CareDev as well. But wanted to just put that plug in there. So I think what we'll do now is we'll kind of open it up to questions. I'm just going to leave it on this screen for a second here as well, and then maybe I'll stop sharing. And then if people want to ask questions, or maybe there's questions in the chat, I'll have to take a peek. Um, but again, like Jap and Ryland are going to be those main people that can help get your clinics set up with eReferral. But also if you're already set up, to support you with some of the maybe improving efficiencies with how it's set up. So setting up user settings in a way, if maybe there's some clinicians that work at multiple locations, like adding those multiple locations to your account, or showing you again how to add attachments to a referral that's already in progress, or how to manage referrals already in progress. I think there's lots of benefit that they can provide to your offices. And again, it's free of charge, the support, so you don't have to worry about any costs on that aspect. But yeah, I think we'll open it up to some questions that anybody might have.
Ray, there's a comment in the chat. My biggest frustration is the 200 character limit in the HPH box. Is there any way to override this?
And the HPH history of past health, I'm assuming is what that is. Jap, I don't know if
I
I
think
don't
that might
believe.
be a CareDev one, because any sort of free text box in Ocean don't have a character limit in terms of like our CPP, which would be previous family history, which would be like HPH, I think. So this could be a cared of one, but Marina, if you want to specify whether this is a cared of or ocean issue.
Hang on, can you hear me?
Yeah.
Ocean, yeah.
Okay, yeah, no, it's when I do an ocean referral. Often my history is just too long now. I have to sit and pick out which part of my history I want to share and delete. It's just very, it gives me all these characters that I'm not allowed to have in there. That I understand is maybe a bit difficult to override, but it's just really frustrating that I constantly have to sit and shorten my history. You just want to attach your profile and go.
Yeah, well, you know what, guys? I hear a lot of feedback from a lot of physicians. This is surprisingly new to me. Granted, I do normally work with specialists. I'm trying to sort of open that attachment to see. But this is something I promise I'll take away. So part of my job as a referral change management specialist is to communicate to Ocean what enhancements we're looking for. So I'm going to do a little bit of testing on this,
Right.
and I'll touch base with Raymond, and I'll see what Ocean says. It could be a workflow issue on our end, but I honestly don't think so. If it's so many of you having this issue, it's probably just like a Ocean integration issue from TELUS that they're not
Mhm.
accepting all the text that you guys want to. And I realize that's kind of frustrating. And for receivers, they would potentially want that level of information. So not sure why they're not including it, but I hear you. I don't think I have a solution right now, but that doesn't mean I won't have one in the
No
future.
problem. No, I mean, I just thought if you guys want to maybe look into it, it might be something for the future. Thank you.
Yeah, and maybe one thing as well, Jap was kind of talking about it earlier in the presentation, but with the standardized referral forms, and the ability to provide feedback through the Amplified Care website on when they're building some of these forms. I think as much as possible, we want to try to highlight issues like this.
Mm.
Um, we almost want to flood it with all the issues that we're having so that they take it seriously and the feedback when they're doing the referral forms, they do make adjustments to them. So I know they do actually read all the feedback pieces that go into those standardized referral forms ones. Um, so I think we have to also put that information in there. Also great, Jeff's going to take that back. I'm wondering if I don't want to necessarily call it a workaround, but I'm wondering if as well we can utilize like there might be a green barring feature, maybe that might be helpful in this situation. I'm not too sure.
Yeah,
Um,
that actually, I do know
Yeah.
for issues like that, like sometimes people will add the CPP as an attachment, like as a PDF or
Oh, okay. That would help. Yeah, I'd never thought of that.
yeah,
Hmm.
and then you would get around that sort of issue because attachments, the only limitation is that it has to be 10 megabytes, I believe. But if you're just
Oh,
sending a CPP,
yeah,
it's
but
very
that
tough.
that that's a lot. Yeah. I don't want to waste everybody's time, yeah, but I missed how to attach something after the fact. Can you quickly show me again? Once
Sure.
I've sent my referral, or I often find right at the end, as I want to push send, I go, oh, I didn't green bar things. And then you have to go out, go back into the chart, and yeah, how do I do that?
So, let's say for this patient, we're gonna have like a few sent referrals. Uh,
Hmm.
Raven, you can see my screen, correct?
yep.
So what I'm going to do is I'm just going to attach, another previous consult. This is after I have sent the referral.
Okay.
So I'm going to green bar what I want. I'm going to attach it, um, create the attachment. And now if I click view in Ocean,
View and ocean. Okay, that's the part I missed. Okay, view and
so I'm going
ocean.
to
And
select the referral that
the
I want to
pending
update.
ones. Aha, thank you.
And now if I
Add it.
add an attachment,
Okay.
you
Thank you.
could,
I just missed that view and ocean part.
yeah.
Okay. Thank you.
So
Thank you.
that'll bring up all the referrals for that particular patient.
Perfect. Thank you.
But no, I don't consider these waste of time questions. These are very important questions. So if anybody else has some, I saw some stuff in the chat. Let me just go through it. Stuart, yeah, I'm hearing you. I think we just spoke about it, so I agree. It is something I'm going to look into, and I'll hopefully get a resolution to that. Jacqueline, thank you for the screenshot. It's very helpful. I'll be sending that off when I speak to Ocean and when I speak to the rest of my team. And for Alexandra, you have access to an IT specialist. Um, we put an email in the chat, and it's my support email, but I'll put my own email here. Um, and so you can always email me directly. I respond fairly quickly. ECN concerns. Raymond, do you know what that acronym is?
Primary care network. So I think the primary care network has been collecting feedback on the diagnostic imaging forms. So it looks like Dr. Choi just sent me a PDF with when she's put it in the chat actually with a list of the feedback on diagnostic imaging forms. But I see you have pulled up the
Yeah.
standardized referral form site.
Yeah, so the best place to put in feedback for a form is on this website. It's linked in the PowerPoint, which I'm pretty sure Raymond is going to be sending out later. Um, there's also an email at the bottom, so eRefferal@amplifycare.com. I'm going to be pretty honest with you guys. Like I've had this request before that we want to change XYZ on a referral form that's already created, which is this completed standardized form section, which medical imaging will fall underneath, which is what I think you're talking about. They haven't seemed too receptive to changes so far. What we have agreed, deployment teams such as myself said we need a regular review period. I believe the medical imaging review period is coming up in April or May. So if you send in your sort of information to this email or to me directly, I'll send it to them and they should respond by April, May about changes that they're looking at making on the referral form. I know it's really, really helpful when they get um, feedback from physicians directly. The only reason I gave that kind of spiel at the beginning is they don't seem to be too quick on making the change, but hopefully they're going to make one quarter 1 of next fiscal. Oh, and if you sent it to, yeah, if you send it to Ryland, that guy's a machine. He's for sure provided it to them already. But like I said, that sort of information about that regular review period just came back now. So maybe Ryland hasn't communicated that back to you yet, Dr. Choi, but hopefully April or May we'll get some news there.
Awesome. We might have time for another question or two if anybody has one.
Yes. Also, if there's no other questions, I'm sorry, I didn't. There was somebody speaking on mic earlier asking me about the attachment question. If you send me your email directly, I can send you some guides that you can share with, your admin or other clinicians in your group on how to add attachments out after the fact. So, you don't have to teach everybody on an individual basis.
Thanks, Shop. I'll send you an email.
Thanks, Marina.
Awesome. Anybody have any other questions about getting support or anything e-referral related? All right,
There's
doesn't.
one,
Oh,
if can we walk them through a CareDove referral? Um, I have some screenshots, Raymond. I could pull those up, or I could launch an Ocean to CareDove one. But that's like Dr. Choi, is that what you want to see? Ocean to CareDove?
I think from a primary care provider perspective, probably that would be beneficial. I think, Jab, if you pull up the health map,
Yeah.
um,
Give me one
and
second.
we might not be able to actually send the full referral, obviously, because there'll be live destinations, but um,
So I may have one. So the way you refer to cared of via ocean is these listings look like any other listing. What would happen is, let's see if I have a test listing. Uh, so you would find, your cared of listing. You would click send e-referral.
You just
You
have
would,
to, you're not showing your screen right now, by the way.
oh, sorry. Give me 1 second. Um, so a cared of listing appears on the ocean health map like any other referral. What the integration does is it translates that ocean e-referral that you send into something that cared of can read. So it's a bigger deal to the receiver, I would say. For you, it's sending a referral to cared of or to an ocean endpoint is the same thing. Um, in a lot of cases, you would not even know that it's a cared of sort of listing, other than in the name. So if you send a referral to cared of, um, it comes up like a regular referral, and autofill templates usually aren't available even though they show up. So you would just answer the referral questions as per normal. You would add in the attachments as normal, and you would send that off into the CareDove environment. And CareDove would receive that referral, not in Ocean, but obviously in CareDove. That's what the integration takes care of on a receiver's
Mhm.
end. And
Mhm.
hopefully I can pull up I'm unfortunately the with the new PCCG agreements, I can't actually send the referral to show you what it looks like, but I do have a
Mhm.
screenshot, which I will pull up if you just give
Okay,
me
so
one
so why don't
second.
we just do hydromorphone sub-Q PRN? What's the recommended dose? I
Oh,
think it's 0.5
uh,
milligrams.
there we go.
That's okay. So
Um,
a couple of things, like I'll pull through because I thought this question might come. Um, so that's self-referral. Just give me 1 second. There is a sender portion. Thanks for bearing with me, everybody. So this is the PCP walkthrough. So you select your service, you would send a referral, your information populates the ocean form. Some places on CareDove, they have where you can select an intake appointment time, so that will pop up. And then you would fill out the CareDove portion of the form, which is pre-populated, and then the referral complete would come over here. So this is skipping over some of the steps where you're actually putting in the information, but you fill out that ocean referral form, it launches this sort of um, they call it like a iHook or something, but like another portal within a portal, and you would go through the CareDove portion of it, and then on the receiver's end, it would come through them in CareDove. But functionally, it's the same as sending an Ocean referral. Did this answer your question?
I think it was Dr. Troy who was on the phone too right now. I think for anyone else interested, just thinking and cared of as well, I think again reach out to Jap and Rylan to support with any e-referral onboarding, and if you do have questions about the cared of aspect, they can support that as well when they're helping you with e-referral in general. I know it's one of three, so you want to just respect everybody's time. But I appreciate everybody joining today. Hope you found this information helpful. Um, and yeah, so we have some of the contact information that we shared. And if you forget that contact information, you're more than happy to just reach out to myself or anyone in the OHT, and we can get you connected as well, whichever way. But thanks everybody for joining.
Thank you, everybody.